Okay, now let's see a case related to angiotensin. Okay, here we go. What would happen if you gave NSAIDs to 75 or 80s? Okay, 75-year-old man who is hemorrhaging. Okay, now this is a patient who is 75 years old. He has come to your clinic, and if you are given NSAIDs, what would happen? Okay, now let's see what would happen. Okay, now we can clearly appreciate that hemorrhage, this bleeding, is a stressful condition, isn't it? Okay, so it's a stressful state. What happens when you're in a stressful state? Okay, that is, this is how he's bleeding now. He's continuously bleeding. What happens? Okay, so now to control the bleeding, the sympathetic stimulation of our autonomic nervous system will happen. That is, it tries to increase the blood pressure by sympathetic tone. Okay, during this stressful condition, what it does is it increases the sympathetic tone, causing vasoconstriction. Now, where is this vasoconstriction? It will be in the afferent arterioles of the kidney. Okay, now what's this afferent arteriole? Okay, I'm not really good with diagrams, so here I got one for you guys. So now this is the nephron, and in this is the glomerular capillaries, and this is the Bowman's capsule, as you can appreciate it clearly. And then these are the peritubular capillaries, from where good substances are reabsorbed, and like sodium, chloride, and electrolytes, and the bad substance has been secreted so that they are freely passed in the urine. Okay, this is the basic mechanism behind this. And now this is the afferent arteriole, afferent or afferent, in which blood comes here and leaves from here, efferent. Okay, so let's go back to our case. Okay, so it vasoconstricts in the afferent arteriole, so that what happens when it vasoconstricts in the afferent arterioles? So usually vasoconstriction in the afferent arterioles. Okay, what happens to the GFR really? Okay, now let's talk normally what happens when afferent arteriole has been vasoconstricted. Okay, GFR decreases, renal plasma flow decreases, and also the filtration fraction, what it does, it increases, and hydrostatic pressure in the peritubular capillaries decreases, oncotic pressure in peritubular capillary increases. Okay, so now it has been constricted. When vasoconstriction happens in afferent arteriole, obviously since the lot of resistance is kept against this, so GFR is decreased here, and renal plasma flow is decreased. Since more resistance is there, filtration fraction, in order it want to filter more, it increases. Okay, and in peritubular capillaries, the hydrostatic pressure decreases. Okay, hydrostatic pressure, what is hydrostatic pressure? Hydrostatic pressure is something that which it increase pushing water outside the vessel, and oncotic pressure is something that what pulls water inside. Okay, now in this peritubular capillaries, since hydrostatic pressure is low and the oncotic pressure is more, since so it reabsorbs water more. Okay, this is how it is. And now along with this, let's see the normal function of angiotensin 2. Okay, angiotensin 2. What happens to the GFR when angiotensin 2 is being vasoconstricted? Okay, now here is something you have to know. In angiotensin 2, when it vasoconstrict, it vasoconstrict more on efferent arteriole rather than afferent arteriole. Okay, that's what it is. You have to accept it, you have to just take it. Okay, it constrict, it has more effect in efferent arteriole. Okay, it has more effect in efferent arteriole. So what it does to the GFR? Okay, GFR increases and renal plasma flow decreases, filtration fraction increases, and rest everything is same as how vasoconstriction happens in efferent arterioles. Okay, now this has been vasoconstricted. What happens if it has been vasoconstricted? GFR will be increases. There's no much resistance against this, so GFR increases for this place. Okay, okay, now let's come back and see what happens to our case. What happens to our 75-year-old man who is still bleeding? Okay, now as we all know that this is such a stressful condition, what happens now? Vasoconstriction of the afferent arteriole in the kidneys. Okay, so during this vasoconstriction of this afferent arteriole, we'll have the compensatory mechanism. We have compensatory mechanism called prostaglandins. Okay, what does this prostaglandin do? A prostaglandin does complete opposite of the sympathetic tone. What it does is it vasodilates. Okay, it vasodilates the afferent arteriole and tries to compensate, for the volume. Okay, try to increase the volume whatever is there so that the man could be alive. So when this unopposed vasoconstriction from sympathetic nervous system and angiotensin 2 happens, that means when the body is not able to vasodilate and compensate for the volume loss, then this unopposed reaction of vasoconstriction of the sympathetic tone and also of the angiotensin 2 leads to severe problems, and which can lead to reduction in renal plasma flow and also GFR, which in turn leads to, I think you can guess what eternally it can happen, finally renal failure. Okay, now production of prostaglandin is good, but when it dies, so the production of prostaglandin is good for us. So drugs like Nsaids to inhibit them. So when production of prostaglandin stop, then the real problems start, as we seen above. So you might be aware that prostaglandin PGE2 and PGI2. Okay, these are the ones which are made to interfere with these things. And prostaglandins do prevent the ischemic damage during these conditions like stress, like hemorrhage and all. And last, you need to know some important facts about this angiotensin 2. Angiotensin 2 preserve GFR during volume depleted states. Volume depleted, like sometimes you might be going to places where some deserted places, okay, where you'll be dehydrated totally. Then angiotensin come into the action. Okay, what it does, it preserves GFR. I mean, it decreases GFR. Now please don't start wondering now how it decreases GFR, then how the problems with it. Okay, there's nothing to be worried. Decrease in the GFR in the sense it doesn't decrease drastically. Okay, it decreases slightly. Why it decreases slightly? Okay, is it good or bad? Okay, good or bad? What do you think? Okay, yeah, it's good. Now why it's good? Because what it does is it doesn't let all the fluid get excreted. So if it decreases GFR, it results in less fluid filtered, and when less fluid is being filtered, which results in less fluid excreted. Decrease fluid filtered decrease fluid excreted. Okay, however, if there is drastical or large decrease in the GFR, then it is a problem. Okay, that's abnormality. That's too bad, I think. Okay, when a lot of GFR has been decreased, you will lose all the good substance and the bad substance too, which are, I mean, we actually need the bad substances like urea and creatine in order to balance the electrolytes. We need them. Okay, we can't just throw off everything. So angiotensin, what it does is it prevents decrease in GFR. Okay, it preserves it. So that's how physiologically angiotensin preserves its GFR, that means decreases slightly, so that nothing much filtration will occur. Okay, and then one last thing you should know about the JG cell, juxtaglomerular cells. Okay, juxtaglomerular cells also release renin. They have similar actions to the sympathetic tone. They do have similar actions to the sympathetic tone, and it also helps in all of this. Okay, these all are the compensatory mechanism required for our good lively being. Okay, so winding up, this is how it works, and we have discussed about the angiotensin 2, and we have discussed the case. Okay, I hope it helped, and I suggest you to know a little more basics about it. It'll be easier to understand. Okay, since we are limited on time right now, we haven't discussed much of basics, but I'm sure you know all of them. It'll be more easier to understand all of it. Okay, I suggest you guys to definitely go through the filtration, reabsorption, secretion, and glomerular filtration rate and rest of them properly.